Lots of mums have problems and difficulties in the first few days. The baby can be feeding and they think, well, that's great, but if it's not effectively attached, then the mum might end up getting pain or damage, or the baby is going to get unsettled because it's not getting as much milk.
Many hospitals have infant feeding specialists like Anne who can help with breastfeeding. First-time mum Salvana has got sore nipples and has come to the hospital with her 3-week-old to get some advice.
You have a little crack around the base of the nipple, mainly at the top there, and the reason that's happening is because when the baby's sucking on the breast, she doesn't have enough breast tissue in her mouth. So it's very important when the baby goes on that we get enough breast in her mouth so that there isn't that stretching of the nipple, and the nipple's far back in her mouth and isn't going to be...
There are many positions you can use for feeding. Salvana is comfortable with her baby in the so-called rugby hold, with her body supported under her arm. Anne is helping her ensure her baby attaches well at the breast.
You want to have the baby lying very, very close to you, your arm along the baby's back, supporting the baby's back right up to the neck, but not touching the baby's head. You want to be sure that the baby's body and neck and head are all in a nice straight line so that the baby's not having to twist around to get to the breast. That'll make it uncomfortable and also difficult for baby to swallow milk straight down into his tummy. So keep the baby nice and close like that. Now, the most important thing when the baby's in this position is to have the baby with the nose level to your nipple, okay? Then you wait for the baby to open the mouth. Now, sometimes babies move around quite a lot, but you just need to be very patient, keep your breast still and let the baby move. Now, keep your nipple aiming up her nose and just think about her chin getting in underneath the breast. That's excellent, right? And then quickly in. That was good. Now, she should quickly relax and go into those lovely big deep sucks that she's doing where her chin's moving right against the breast. That's just letting the milk flow into the ducts and then she has a wee rest and then keeps going again. It is worth making sure everything is there and this is the best it's ever been. And if it isn't, detach the baby, take her off and start again rather than putting up with it and thinking, I'll get it better next time.
If you need to take your baby off the breast to help her attach better, it's important not to pull or force her while she's feeding. This'll hurt. You can do it safely by putting the tip of your little finger in the corner of the baby's mouth to break the suction gently.